Have you ever stopped to really think about, well, the invisible stuff? Challenges hiding right there in plain sight, especially where our most vulnerable live. I mean, the actual air we breathe. Its quality has this huge impact on health, particularly in elderly care centers. Okay, so let's unpack this. We're doing a deep dive today into ventilation and indoor air quality, specifically looking at those typical two-bed rooms you see in ECCs, and this is all based on some really cutting-edge science.
It's fascinating and honestly so critical right now.
Yeah.
Think about it. The global population is aging rapidly, and elderly individuals, their immune systems are often, more vulnerable. They're just much more susceptible to air pollutants, even in levels you or I might not notice. So getting the air quality right in these places, it's not just important, it's, well, paramount for their well-being.
And here's something quite stark. In a lot of current ECC bedroom setups, the CO2 levels, they often shoot way above 1,000 parts per million. That's quite a bit higher than the CDC's suggestion, which is more like 800 ppm for vulnerable folks. But what does that actually mean for the residents day to day?
Right, you've hit the nail on the head. It's not just a number on a chart. It translates directly into real health problems. We're talking headaches, feeling dizzy, even an increased heart rate sometimes. Imagine trying to rest or recover when the air itself is making you feel unwell. For someone already frail, that's a big deal, a real barrier.
Okay, so clearly a big problem. How did this particular study try to figure out a solution? What was their approach?
They're pretty comprehensive, actually. They compared 4 different ventilation types. You've got the standard mixing ventilation, kind of just spreads air around. Then displacement, which is more floor to ceiling. Zone ventilation, targeting specific spots. And then the one that turned out to be key, stratum ventilation. And they didn't just test these in theory. They ran 12 different scenarios, factoring in real things like, those privacy curtains between beds. The goal was to find the best practical design.
12 scenarios, 4 types. That does sound rigorous. So digging through all that data, was there anything that really jumped out as maybe unexpected?
Oh, absolutely. Here's where it gets really interesting. It was about those privacy curtains. You'd think taking them down would be good,
Right.
and removing them did slightly lower CO2, maybe by up to 8%. But, and this is the crucial part, the study strongly advises against removing them.
Wow. Okay. So even though it slightly improves the air, they say don't do it. Why such a strong stance against it?
Well, the reasoning is really important. Taking down those curtains significantly bumps up the risk of viruses spreading between residents. Obviously, that's a huge concern in these settings. But just as vital, maybe more so, is privacy. Removing curtains really compromises the basic dignity and privacy of the residents. And it brings up this fundamental question, doesn't it? How do you balance clean air with basic human needs like privacy and respect? It's not just about the parts per million.
Okay, so if removing curtains isn't the answer, what is the breakthrough? You mentioned stratum ventilation.
Exactly. Stratum ventilation, or SV.
Yeah.
And the results were pretty dramatic.
How dramatic are we talking?
And while SV managed to get CO2 concentrations down as low as 400 ppm in key areas. That's way, way below those problem levels over 1,000 ppm we see sometimes.
400, that's a massive difference. How does it work so much better?
Its performance was just superior across the board. Take something called contaminant removal effectiveness, or CRE. SV was found to be, 2.58 to 3.22 times more effective at actually clearing out pollutants compared to the other systems, even with the curtains up. And that directly translates to better health outcomes. SV slashed the health risks by somewhere between 41% and 53% compared to the other methods tested.
That's incredible. So is there a specific way it needs to be set up?
Yes, the study recommends a very specific configuration for SV to be optimal. You want the air outlets positioned right near each pillow, the breathing zone, essentially. And then the air inlets should be on the opposite wall at about the same height. The genius is its precision, really. It delivers fresh air right where it's needed most, pushing out the bad stuff without creating drafts or compromising that personal space defined by the curtains.
Which makes so much sense for these specific rooms. ECC bedrooms aren't like hospital rooms or hotel rooms. They have unique needs, right?
Right.
You have to think about long-term care, maybe residents who are bedridden, plus all the safety stuff like handrails, wider corridors, and yes, those privacy curtains. SV seems designed for that reality.
Exactly. So what does this all mean for you, the listener? This research gives us a really clear, actionable path forward. It shows how we can create genuinely healthier indoor spaces for elderly residents. It's more than just airflow. It's about dignity, comfort, well-being.
So if you're connected to an elderly care center, maybe you work there, have a family member there, or you're involved in design or management, you now have something concrete. You can advocate for stratum ventilation. And Be Specific mentioned that optimal placement near the pillows with inlets opposite. It's a practical step towards better care.
And maybe one final thought to leave you with. Beyond just the physical health benefits we've talked about, the lower CO2, fewer contaminants, how might these kinds of innovative ventilation designs also boost mental well-being? Think about the feeling of comfort, maybe even reducing anxiety for residents, especially those needing long-term care. Could just knowing the air is clean or simply feeling truly fresh air make a difference to their overall sense of peace and security in that space? Something to reflect on.